thank you for joining us for another episode of Senior Answers. My name is Maria Madrid. I'm the Director of Latino Services at the Colorado Gerontological Society. Today's episode is on hospice care and palliative care. Our guest is Rachel Martinez. She is a licensed counselor and end-of-life certified death doula. She has over 20 years of experience working in the senior care industry. For the last 12 years, she has specialized in hospice care. She has experience working directly as a hospice worker and also in conjunction with the hospice care team as a social worker. Her expertise also includes supporting families in their end-of-life goals. She notes that one of her greatest honors is to be able to sit at the bedside of hospice patients in their last month, week, and days of life. Rachel, thank you for joining us today and sharing your expertise.
Thank you so much, Maria, for inviting me and for allowing me to do this with you today.
Thank you. So there's a lot of information about just palliative care and hospice care. And my goal today, as we have this conversation, is for individuals to become more aware about hospice care, what it is, how it works. So we're very excited to have you today because I think with your expertise, you'll be able to clarify. And I think where we should start is hospice care. So we'll just go through different questions, and as you answer anything or want to add anything, please feel free to do so. Let's start with, what is hospice care?
Well, that's a good place to start. So hospice care is a specialized program that provides compassionate care for those nearing the end of life. So I think kind of a fun, interesting fact is that hospice care as we know it today started in 1974. And the hospice benefit that we call the Medicare hospice benefit actually started in 1980. So the hospice program is really not that old at this point historically.
All right, so now that we know a little bit about what is hospice care, we have, and everyone should be able to see this, the phases and layers of care. Is there any information that we should pay attention to on this graph?
Well, this graph really does a nice job of showing both the palliative, the hospice care, terminal care that we look at. So when someone is at the end stages of their life, the programs that are there to support them, that have been created to support them, and supporting them both in the physical and emotional and spiritual elements.
Awesome. And I think you've started with the next question that I have for you. What are the services and supports provided under hospice care, and where are they provided?
So hospice care can be provided anywhere. And that means in someone's community home, a nursing home, assisted living, homeless shelter. Even when I was working on a team out in the field, we actually went to a park to work with a homeless man. So all settings, we can provide those care needs. With hospice, a team of people are coming to you, to your home. And that would be a doctor, nurse practitioner, an RN, so a nurse, a certified nursing assistant who does all the bathing, social workers, chaplains, and a volunteer. So a volunteer can provide many different supports. COVID has made that a little more challenging, but definitely can provide services for companionship or music therapy, dog therapy, and just giving the family member a break because maybe they just need to go to the grocery store. So volunteers are a big part of the hospice care as well.
Thank you for clarifying that for us. I think there's a lot of misconceptions about having to go outside of the home to receive these services. So thank you for the emphasis that this is a service and just overall supports that could be provided anywhere. So can you tell us a little bit more about services at end of life?
So there's a lot of coordination of care based on the family members and patients' needs. Some of the things that we often provide support with are home care. So looking at what are the resources outside of hospice that can come in to the home and helping family members coordinate that. And things like life alert buttons to let them know if their loved one has fallen, those types of resources. Respite care is also a resource that's available to hospice patients for 5 days in a care center. And so those things are all resources, generally speaking, that the social worker is going to be working on, but also emotional support is a big component as well to the hospice care services.
Can you give us a little bit more information about services after death? Because I think since there's a lot of confusion with what is hospice care, some people think that those services stop as soon as the patient passes away.
Yes, so that's a good question because every hospice does this a little different. So there are services that we call bereavement services, and it can offer for up to 13 months is the Medicare requirement. They can offer one-on-one counseling, groups, support groups. There are phone calls that the counselor can reach out, newsletters, and actual services of remembrance, where you'd come together and remember your loved one as a group. So those are all possible bereavement offerings that a hospice can offer.
So let's move on to more information. So how do individuals become eligible for hospice care?
So hospice care, as we talked about, is for those who are 6 months or less, according to the doctor, is telling us that they have of life. And a doctor actually has to write an order, a doctor's order that says to the hospice team, I believe that this person has 6 months or less to live. That once that referral is received by the hospice team, they actually go out, the nurse will go out and coordinate with the doctor, review the chart, review the information, as there are Medicare guidelines that hospice is required to follow to determine whether or not that patient will be eligible for those services. So that's the general way that goes about. And a patient can simply call us and say, I'm not doing well. I haven't seen my doctor in a long time because I can't get out of the house, these kind of things. And hospice can actually go to them, assess the situation, and ask for the doctor's order. So all of those things, it can happen either direction.
Okay, thank you. So now that we know how you're eligible, can you tell us how does someone go about getting hospice care?
So I think we kind of reviewed this already, but they do need a doctor's order, so that referral goes to the hospice company, and then the hospice nurse actually goes out to do that assessment, which then will determine whether or not they're on hospice. And I don't. Sometimes there's confusion in thinking that because an order is written for 6 months, that hospice only lasts 6 months, and then what happens? So hospice is actually assessing routinely to determine whether or not this patient is still meeting eligibility. And as long as they are, they will remain on the hospice program. Could be far beyond the 6 months if those services are still needed at that time.
Thank you for clarifying that 6-month period, because I know some individuals, once they go into hospice, their family and the patient themselves have questions about, what if I have more than 6 months to go, and what does that look like? So it sounds like everything is very coordinated. There's ongoing supports. It doesn't start and stop with just one visit, right?
Absolutely, yes. So that team would go out and assess, and if for some reason they're not eligible, that's okay. We can always look at what those outside resources are for them, and then come back and revisit. We'll talk about palliative here in a little bit, but maybe they're more a palliative patient than they are a hospice patient at that point. So.
Okay. So let's talk a little bit about advanced directives at end of life. As you know, the Society does a lot of work around advanced directives, and we want to know how the advanced directives work in a hospice care scenario.
So the form that catches the most attention, or immediately we're asking about, is a medical power of attorney. And the reason we're asking this is because if a patient isn't able to speak for themselves at any point in our program, we need to know who to go to give us direction. So if the patient themselves is able to make that decision, then that's the time to actually get that medical power of attorney in place. To say, I really want my husband, I really want my daughter, whoever you think could be the most stable during that difficult time, and will follow through with what your wishes are. So that's the first thing that's super, super critical in this process. If a patient for some reason is not able to speak for themselves at the point that we meet them, what is called a medical proxy needs to go into place. So the medical doctor, nurse, social worker, generally social worker, is going to be looking at who are the players of interest, who has interest in this patient and their best good. And they're going to be bringing those couple of people together and saying who should be the medical proxy. And so a form can be filled out to determine that this is actually the best person. This person has their best needs.
So, Rachel, what I hear you say is that, the medical durable power of attorney is a very important document, and base case scenario is that they come to hospice care with that document already completed. But if that is not the case, there is a backup plan with the medical healthcare proxy. The one thing that I will add in here is with the medical durable power of attorney, you choose who's going to speak on your behalf, whereas with the medical healthcare proxy, your support system and the medical team in the hospice care setting, they're deciding who is the best person to speak on your behalf, because at that point you wouldn't be able to say. So always base case scenario, complete your medical durable power of attorney beforehand, so that way the medical team and your family do not have to go through the medical health care proxy process.
Absolutely. Yeah, I'll just share with you that in caring.com, they did a study and it shared that 53% of US adults have granted someone their medical power of attorney. So that's great. 83% of those are 72, and they have that medical power of attorney in place, but 41% of millennials can't say the same. So we really encourage anyone over 18 to sign a medical power of attorney because we simply don't know. None of us knows. We maybe, in a car accident, something could happen, and we need to have that in place to, to assign someone that we know has our best health interest in mind.
Thank you, Rachel, for emphasizing that. Although the society focuses on older adults, advanced directives are for everyone 18 and over, everyone that is an adult. As you said, not everybody has these documents in place. And there's situations that take place that we need the support of someone else because we can't communicate our needs and we need medical care. So even if it's not an end of life situation, it could be an emergency. So one of our big messages for you today is please complete your advance directives as soon as possible to ensure that if anything happens in the future, not that we want something to happen in the future, but if something happens, a medical emergency or another type of emergency, that we just have a plan in place, we have it in writing, and we use advance directives to protect ourselves and protect our families. So tell me, how do individuals pay for hospice care?
So primarily, hospice care is paid for with Medicare or Medicaid. I always say it's one of our greatest benefits in the Medicare plan is hospice care because it will pay for hospice 100% along with the Medicaid option. Also, there is private insurance. We often see this with younger people who have not quite met the age of 65, who do need to use their private insurance. And then there can be some copays involved there. So that all needs to be talked out and assessed. The blessing is that many hospices do have foundations that will help with many of those extra expenses. So that's something that may need to be discussed and talked about before entering into a hospice program. But primarily it's paid for with Medicare and Medicaid.
That is great to hear because a lot of individuals don't understand that hospice care is a benefit that could be covered through Medicare, Medicaid, and private insurance. And also, thank you for highlighting that there's foundations that can help with payment of hospice care services. So now that we know what hospice care is, what services are provided, where we could get it, how are we eligible, give us some information about what should we be considering as we're choosing a hospice care provider.
It's a great question because here in the Denver metro area and in the state of Colorado, there are many hospice choices and palliative choices. So some of the things that I would be encouraging you to ask about is nurse case loads. How many patients is my nurse going to be taking care of along with me? So that way you have a sense of how attentive they may be able to be for you. How often will the certified nursing assistant or CNA be coming by to visit? Is it twice a week, 3 times a week? Can they do more? Will they do more? Those are good questions to ask. And what is the plan if my symptoms get out of control? So if I'm at home and the medication that is being provided isn't quite making it, what's the plan? Is there an inpatient unit that will be considered, or would I need to go to the hospital, or what would be the go-to plan, or would more nursing staff come to my home? So I always would encourage that. And then bereavement services. Looks like we got services spelled wrong there, but that's okay. If you know that you or your loved ones are going to need that one-on-one support or group counseling, important to ask whether or not they provide those services.
Thank you. It's important to consider all these things as we look at what type of care we want at end of life. So thank you for highlighting those things. And now that we've come to understand more about hospice care, let's switch gears to palliative care. Let's start with, what is palliative care?
So I'll just start off by telling you that the word palliative actually means to relieve pain. And when you see a hospice company, sometimes you'll just see their name and then you will see and palliative. So it could say, hospice care and palliative care, or it can just say hospice care. So when you see the two different names, it's actually telling you that they have two different programs that they offer. So the Mayo Clinic basically gives us this definition, and I think it's just a real nice picture for you, so I'm going to read it to you. So palliative care is a specialized medical care that focuses on providing patients relief from pain and other symptoms of serious illness. No matter the diagnosis or stage of the disease, palliative care teams aim to improve the quality of life for both patients and their families. This form of care is offered alongside curative or other treatments you may be receiving. So the difference between the hospice and palliative program is that in palliative, the patient can still be receiving curative treatments. So they can still be receiving chemo treatments or dialysis treatments along with this program.
Thank you for that. I know that folks get confused. So the key takeaway is palliative care, it's helping with symptom management. You still are receiving treatment for whatever it is, whether it's cancer or whatever have you, and you're getting this personalized special care to help you through that process. Whereas hospice care, it's end of life. Am I getting that right?
Yes, that's right. You're doing great.
Okay, thank you. So now that we know what palliative care, what are the services and supports that we should expect to receive under palliative care?
So as we said, palliative care is a specialized care. So you would actually get either an MD or a nurse practitioner to your home. And the hope is that if you're receiving treatment through your doctor or cancer treatments, whatever the treatment is that sometimes you may be waiting, a couple weeks, maybe a month for your next appointment. And in those periods of time, your symptoms may grow out of control. And this is where the palliative team, you can literally pick up the phone, call the palliative team and say, look, I'm needing some support here. My symptoms have gotten out of control. And I know I can't wait, or sometimes just trying to get to the doctor phone line to get what you need can be stressful. So you would call the palliative team and they would actually come out to your home and assess your symptoms and look at possible medication treatments or alternative treatments that can help manage your symptoms. So they're still working with your primary doctor, whomever your doctor is. They're reporting back, letting them know about the changes, and then assessing, and still there for you 24/7 on the phone.
So how do individuals become eligible for palliative care?
So much like hospice, palliative care is also needs a doctor's order. So could be your doc, talks to you about the palliative program, sends out the order to a palliative team. And so these are also people who are dealing with some kind of serious illness, like I mentioned, cancer, heart disease, liver disease, but they're also receiving some curative treatments still. So once that order is received by the palliative team, they come out and, just like hospice, do the assessment and determine needs at that time. You may find that some patients just need that nurse practitioner. Others might need a nurse practitioner and a social worker. So it's important to ask those questions. Do they have social workers? Many of them do. So use those resources if they're available to you.
And how does someone go about getting palliative care?
So as we just talked about, the doc order would then determine would come to the PAL team and that referral would be made. Or remember that you can just simply call in to the palliative company also and let them know what's going on, and they can do the assessment just like that and then go to your doctor and ask for that order. So either way, you're still very much in control of all of these cares and your needs. And PAL is really managing symptoms, so that's going to be their primary focus.
Just like I asked with hospice care, how do individuals pay for palliative care?
So I just want to go back one sec, if it's okay.
Oh, yes, of course.
Yeah, so some of the symptoms that they're managing are pain, nausea, anxiety, depression, constipation, difficulty breathing. So I just want you to know that can look in an array of things. Also fatigue, trouble sleeping. So it can be multiple different types of treatments they're offering. So to talk about the PAL care, so private insurance, Medicare, Medicaid, they will offer usually a percentage. So remember that this is a specialized, so it's just like seeing a specialist. So if you're going out to see a specialist, what is the percentage that your insurance will pay for? And then what is your out-of-pocket expense? And so that's what you'd be assessing when you're looking at palliative care.
So unlike hospice care that covers, Medicare covers everything, it would be a different amount that you would have out of pocket based on your Medicare coverage, and the same with your private insurance. Okay.
That's right. Yeah. So it would, again, it just is looking at what is your cost to see a specialist, and the hospice and the PAL team can actually determine that. They have an office in the back usually who manages the financial piece, and they can assess that for you ahead of time, so they can help you through that process.
That's wonderful to hear, because I know that when families are trying to figure out supports and services, sometimes that could be pretty overwhelming. So as we are trying to consider who we want as a palliative care provider, what are the things that you think we should be considering?
So definitely ask exactly what their program provides, because every palliative team or palliative program is just a little different. So just be specific and ask, how does this work? Who do I call? Who will come out to my home? And then above and beyond, will they offer a social worker if resource support is needed? And will they send out a chaplain, and how often? So those are just some important questions to ask. Some may be able or willing to go beyond that and offer larger services. So just good to ask a lot of questions with PAL, because they are very different. It's unique to each company.
Okay. So basically, depending on what's going on with your symptoms and what you need, it's very important that you discuss those symptoms to see if that palliative program matches up with what you need.
That's right. That's right.
Awesome. So right now, everything is being impacted by COVID-19. And as we have that question mark on when we will be in a post-COVID-19 era, what can you share with us about how COVID-19 is impacting hospice care and how palliative care are being delivered? Just so our older adults, our caregivers, understand how, if they haven't received those services before, how COVID-19 is impacting things, and kind of just heads up if this is something that they need at the moment.
Right. So I will assure you that hospices and PAL teams are doing exactly what they need to be doing as far as wearing their PPE, getting vaccinated. They're being very cautious with all of those pieces, and of course, hand washing and hand sanitizing, and asking the patients themselves, if possible, to wear a mask so we can avoid any spread of the virus. The things that have impacted us the most initially was in the nursing home and assisted living settings. Some facilities were allowing the nurse to come in, some were not. In some cases, initially, they had to actually stand outside the window and explain to the caregiver inside how to provide those cares and train them in that manner. We're finding now that as long as a facility is not infected, where they're allowing now the nurse and the doc and the CNA in most cases to come into the community. Home care, we pretty much went along as we had been, except putting the PPE in place, so the protective equipment, so wearing the masks and gloves and depending on the situation, possibly gowns, all of those pieces to protect both the healthcare worker and the patient. So those have been kind of the biggest things, the biggest challenges, and each place was a little different based on the amount of infection they had in their building. So it required a great deal and has continued to create a great deal of communication between the hospice teams and the facilities, the communities, and the patients to find out, in home what their wishes are.
So then key takeaways, depending on where you call home, that's going to change how hospice or palliative care are delivered to you. And the hospice care and palliative care teams are following proper PPE protocols and basically being really flexible with the different places that people call home and in supporting people through the whole process. Thank you for clarifying that for us, Rachel. I know that that could be overwhelming for a lot of folks. I know that I've asked you a lot of questions today, so I wanted to wrap up with, is there anything else that you would like to share or provide us in this huge topic that is both hospice care and palliative care?
Yes, definitely. And thank you for having me as well here today. And I just want to leave you with what I think is the truth, that the death is a natural part of life. It can be a sacred time for many patients and families, and hospice and palliative workers are there to support families and patients in a difficult and mystical part of their lives. So I hope you have found this information helpful, and please reach out to Maria or myself if we can be of greater service to you on this topic.
Thank you, Rachel. Also, I know that you provided some statistics. Where can people go to find this information?
Yes, you can go to any hospice website, and they typically will provide a resource link that can take you and share all of this information that I shared with you today.
Thank you, Rachel, for sharing with us your knowledge and expertise. I know that end of life can be a difficult subject for a lot of folks. Our hopes today that we provided information that could be of assistance in honoring those individuals that need care and provide care. In the description of this video, I will make sure that we have your contact information, Rachel. So if people need to speak to you about hospice care and palliative care, they're able to reach you. So that will be available. Once again, thank you for sharing with us, and have a wonderful day.
Thank you. You do the same, Maria. Bye-bye.